not important for our topic. The striations, you can probably see a little bit of Z, kind of like zigzag striations, and that is normal for the heart. And so with hypertrophy, is this hypertrophy already? So you can already see, I think this patient has MI, and these are inflammatory cells. Just ignore that because we are not still under inflammation yet. We are still going through hypertrophy. Just note the changes that the hypertrophic myocardial cells are more eosinophilic. When I say eosinophilic, it's more pinkish. Homogeneous. How do you say homogeneous in simple terms? Kind of like what? Same color, thickened color, no variations in. Basically homogeneous. You just look it up in the dictionary. And the nucleus will be enlarged. Some would be kind of hyperchromatic, which is hyperchromatic means there's an increase in the nuclear staining from a slight purple to a deep purple. That's when you say hyperchromasia, hyperchromatic. The normal would be what? Normal chromatic, right? So if it's hyper, then you can just assume that it's slightly darker than the normal. And the cross striations that you appreciated, you have seen in the previous slides, you cannot appreciate it here anymore. So these are the myocardial hypertrophy. So yeah, basically that's the things you need to take note, that the nuclei is a little bit enlarged, loss of nuclear striations, and the eosinophilic cytoplasm is homogeneous, it's more pinkish, and the cellular details are not as delineated as before. Myocardial cells basically look like a kind of like an eye, spindle shape. But with hypertrophy, you cannot distinguish cellular outlines anymore. So this is a picture of a normal uterus.